Well, a simple device has just been approved by the FDA, and it could be what the doctor ordered for 40 million Americans who suffer from migraine, tension headaches, all kinds of headaches. And apparently it helps prevent migraines, tension headaches, and reduce the intensity of jaw clenching during sleep, and really reduce the intensity of the headaches as well. Joining us now is Dr. James Boyd, a dentist who invented the device, and Ivy Mansky, who has seen her migraine, she says, virtually disappear since she started using it. Welcome to you both. Ivy, let me start with you. How severe were your headaches?
They were quite severe. I would get 2 to 3 migraines a month, and I would get a sharp pain that would repeat in one area wherever it would be, and I would just have to close my world off until it's ended.
And you started using this, you stumbled on it how?
My husband is a dentist here in Manhattan, and he had been working with Dr. Boyd, and it's a type of device that has reduced the intensity of the clenching people do, and he suggested that I wear it. He experienced me having these migraines and said, try this.
All right, so your husband worked with Dr. Boyd, and Dr. Boyd, I can hear people sitting at home and saying, wait a minute here, wait a minute. First of all, the critics of this have said it cannot be this simple. It cannot work this simply, that migraines are caused by a variety of things.
When you hear the term jaw clenching, it's hard to make that association or that leap to migraine. And that truly, they're not really the same thing, of course. There really is a neurologic storm that happens during a migraine event, and what we've been trying to do is reduce this kindling that precedes this storm, and by reducing the intensity of muscle contraction of the patient's scalp while they're asleep, you reduce the frequency of the migraine event.
So you think that migraines are exacerbated by what? By this clenching by the nerves all over the skull, and that's what you're attacking?
Exacerbated might be a good term to use, in that this jaw muscle contraction, and when most people think jaw muscle contraction, they think about this jaw muscle, when in fact, the most intense muscle for clenching the jaw is up here in the temples. It squeezes this way. You can feel those bulge in and out when you squeeze your jaws together. If that muscle is allowed to contract with high degrees of intensity, which, by the way, which migraine patients do when they're asleep, their frequency of migraines can be increased.
What results are you saying that you see from this?
In our clinical trials, 82% of migraine patients had a 77% average reduction in their migraine frequency.
In frequency?
Right, right.
77%. That's
right.
Big. You said that you had migraines too?
Right. I had a headache every day, all day long for 12 years. I woke up in the morning, took my 4 Excedrin to get out of bed, and took about 12 all day long just to deal with my chronic headache and frequent migraine. In dentistry, the concept is make sure your teeth fit together perfectly. Because you know when you have a filling done, they always want to check your teeth to make sure they fit just right. The problem is with this condition is they put their jaws together and squeeze them tightly. Well, all this device does is reduce the intensity of nighttime jaw clenching. All humans clench their jaw at night. It's the intensity that drives the condition.
Again, we said the FDA just recently approved it. So, Ivy, what is it like to sleep with this?
It took me 3 nights to get used to it. And in the 6 months that I've been wearing it, from 2 to 3 migraines a month, I've gone to 1. I had 1 migraine in 6 months, which has been incredible.
And these are available generally?
At the general dentist office.
Thank you both for coming in this morning.
Thank you.
I know people who have these headaches are desperate.
Yeah.
Desperate for something that might help.